Well, hello and good evening to everybody. My name is Rudy and I'm with Inspire Medical Systems, and thanks very much for joining us tonight. It is 6 p.m. on the dot. We're going to go ahead and get started. And I'm excited that we have not only one, but two guest speakers this evening. Of course, we've got Dr. Breaden, and then we also have a patient ambassador, and this is a volunteer. So it's somebody that actually lives and breathes with Inspire every day. So he'll be discussing his journey toward Inspire as well as his journey with Inspire, and then of course answering all of your questions. But of course, before we get to him, we have a very distinguished speaker in Dr. Radhika Breaden. And as you can see her from her bio, very distinguished is probably just the beginning of everything. Dr. Breaden is the director of Pacific Sleep Program, which is in Portland, Oregon, and along with her partner, Dr. Jennifer Kim. And she pioneered Inspire therapy in the entire Pacific Northwest. And this is a number of years ago. She'll discuss that journey. And since then has actually become a center of excellence. And Pacific Sleep Program and Dr. Breaden are the only center of excellence for Inspire Medical Systems in the entire Pacific Northwest. So we're very fortunate to have her. And through that process, she has also come to the point where she educates other sleep physicians on how to integrate Inspire into their practice. And so before we get to Dr. Breaden, just a couple news and notes. The first is that this meeting is being recorded. And the second is that we love your questions. And so please ask them, any of them, at any time. Just please know patient health information in those. And the way you would do it is just click on that Q&A down in the center, type those in again at any time, and then we will get to those after our patient ambassador speaks. So we get to those all at the very end. And so with that, I will go ahead and pass things over to Dr. Breaden. Thanks so much for joining us tonight.
Well, thank you everyone for coming tonight. And thank you, Rudy, for that wonderful introduction. And with that, what I'd like to do is to talk a little bit about sleep apnea, and then we'll talk about the different treatments, and then talk in more detail about Inspire therapy, how it works, and talk about what the process is to get Inspire therapy. So let's talk about obstructive sleep apnea. One of the things that actually surprises me as I see patients with obstructive sleep apnea is that many people don't really understand what it is. You know, when I ask my patients, I say, do you know what obstructive sleep apnea is? They say, I stop breathing, but they don't really know a lot more than that. So let's talk about that. So when we're awake, our airway is wide open. These muscles here act as struts to keep the airway open. The tongue base falls due to gravity, and the palate raises due to our muscle tone when we're awake. But when we're asleep, these muscles start collapsing or relaxing. The tongue base falls back and the palate drops. And when that happens, we can start getting some friction. When we start getting that friction, it can create a vibratory noise as air flows past it. And that vibratory noise is called snoring. When the airway collapses for at least 10 seconds, that is called an apnea. And if a person has more than 5 of those per hour, that is called obstructive sleep apnea. If a person has more than 15 per hour, that is considered moderate sleep apnea. And anything over 30 per hour is considered severe sleep apnea. And we know that over 20 million Americans have moderate to severe sleep apnea. Next slide, please. What you can see is when that airway collapses, obviously the airflow is going to be restrained, and that will cause the oxygen to drop. And what you can see in this diagram is that with the apnea, the oxygen will go low. But when a person has moderate to severe sleep apnea, the apneas are happening so frequently. And if the apnea is severe and the apneas are happening for long durations, the oxygen level cannot recover back to a normal baseline before the next apnea occurs. And so the oxygen level never really gets back to normal. And so it goes lower and lower and lower and lower. And it goes to very low levels that the body could never, ever allow during the daytime. So we can get down to, 70s, 60% oxygen levels when we're walking around during the day with oxygen levels of 99 to 100%. So that low oxygen that is happening repeatedly during the night can be a significant stressor to the body. And we also know that when this is occurring, the body is responding to this. The body can't let this happen on a regular basis. And so that causes the sympathetic nervous system, the fight or flight response, to kick in. And that has a number of long-term complications because that causes the blood vessels to constrict, that causes the heart to race. And so that causes some of the complications that we see from sleep apnea. Next slide, please. So I often say that I could do an entire presentation just on the consequences of untreated sleep apnea. But in general, the way I break it up is we have our shorter term complications and then we have the longer term complications. The short-term complications have to do with how it affects our daily life. We may have snoring that bothers others. We may have apneas that are worrisome to others. We may wake up unrefreshed. We may be fatigued during the day. We may wake up with headaches. All of those things have acid reflux, those kind of problems. The long-term issues have to do with how it affects our cardiovascular system, how it affects our mood, how it affects our metabolism. So we know that having type 2 diabetes can be associated with untreated sleep apnea. We know that increased risk of heart attack, stroke, atrial fibrillation, and other cardiac arrhythmias are all seen with untreated sleep apnea. And of course, accident risk on the job, when driving, all of those things can be affected. We know that there's an increased risk of depression, increased risk of ADHD, increased risk of anxiety disorder if we have untreated sleep apnea, because all those brain regulation things that are supposed to be going on, all of our neurotransmitters that are supposed to be in balance, can't get refreshed and can't get rejuvenated during the night if our sleep is interrupted. So all of those things are being affected. All of our organ systems are being affected if we don't get good quality sleep. Next slide, please. So as many people are aware, CPAP, or positive airway pressure therapy, is considered a first-line therapy for sleep apnea. And that involves giving some air pressure through the nose or through the nose and mouth through a mask interface to keep the airway from collapsing on itself. And for a good percentage of people, CPAP is a good treatment option. However, we know from long-term studies that there are a significant number of people who are unable to use CPAP therapy effectively. They cannot acclimate to it well. We can't find the right mask interface that works well, or the right mask pressure combination, the right type of machine that senses the breathing. So there can be a number of different challenges. And so there are a percentage of people for whom CPAP just cannot work effectively. Next slide, please. There are some alternative treatment options that are available. Oral appliance therapy, which is a mouth guard that brings the lower jaw forward. These are made by sleep dentists in the community. These typically reduce the apnea index by about 50%. So the main challenge with this is that these are meant more for mild to low moderate sleep apnea. These tend not to be as effective in the higher moderate or severe sleep apnea levels. Anatomy altering surgery involves cutting out parts of the palate, debulking the jaw, debulking the tongue, bringing the jaw forward. There are a number of anatomical changes that are done with those surgeries. They tend to be pretty drastic in many cases. They tend not to be very effective. These are surgeries that were developed primarily before CPAP and oral appliances were invented. So those were the only treatment options. So we don't tend to see pretty robust results with those treatments. Next slide, please. So let's talk about Inspire therapy. So Inspire is a pacemaker-like device that is implanted under the skin. And when a person goes to sleep, they have a remote control that you put against your chest. And when you go to sleep, you push the button and turn it on, and that opens the airway. And when you wake up in the morning, you turn it off. Next slide. So this video will show you a little bit about what's going on in the body. And so I'll just narrate this. So you'll see this gentleman is turning on his Inspire. You can see there that the Inspire has a lead that's going to the airway. This is actually an older video. We no longer need the second lead in the chest wall. And so this is the lead going to the hypoglossal nerve. And that nerve controls bringing the tongue forward and also raising the palate. And what it does is by sensing the breathing, it's also timing bringing the airway open. So rather than actually kind of forcing the airway open with air, the way a CPAP does, this actually kind of gets things out of the way before the apnea happens to help to prevent the apnea from occurring. So let's talk about the pre-implant care pathway for Inspire. So if a person's looking at Inspire, the first thing we need to do is patient screening, making sure that they understand, that we find the right patients for Inspire therapy. Then we do education, which this is part of. There is an airway exam to make sure that a person is a good candidate for Inspire. Assuming all that works out, then a person has the surgery, which is where the device is implanted. And then we do our follow-up and continuing ongoing adjustments with recovery. Next slide. So let's talk about patient screening. Who's eligible for Inspire therapy? So for Inspire therapy, we have the ABCDs. So the apnea-hypopnea index. And in order to qualify, you need to have moderate to severe sleep apnea with an apnea index of 15 to 65. Now, that being said, there are a few insurance companies that don't have that upper limit of 65. And so that does vary based on insurance company policy, but the majority of them do follow 15 to 65. Body mass index of 32 to 35 or less. And again, this may vary depending on insurance company, but typically it does need to be a body mass index less than 35. Documented failure or intolerance of CPAP therapy. And that typically means that we have given a very reasonable try of CPAP. We have tried to make sure that the pressures are correct. We've tried different mask interfaces. We've tried it in the laboratory, maybe tried BiPAP if necessary. That varies from person to person and varies depending on what the reasons for intolerance are. The person needs to have that airway exam I discussed earlier, which is called a drug-induced sleep endoscopy, and that needs to be done by a certified ear, nose, and throat doctor. And the sleep study that is being used to qualify the person for Inspire therapy has to have been done in the 2 years prior to the referral for Inspire. For most of my patients with Inspire, they had their sleep study that initially diagnosed them with sleep apnea long before they came to see me. And so we do need to do a re-diagnosis in many cases to make sure that they do qualify for Inspire therapy. Next slide, please. So let's say a person's a good candidate. They have done some education. They say, yes, I am ready to look at Inspire. I send them over to my ear, nose, and throat colleagues, and they do a DICE, which is where they give the person a little anesthetic to relax them, to simulate sleep. And then they see how the airway is collapsing. So on the left-hand side, you'll see the video of someone who has kind of a front-to-back collapse of the airway. Okay, and that is a person who is considered a good candidate. On the right, you'll see kind of the walls caving in, kind of like a circle. So everything's kind of cinching in. That is called a concentric collapse of the palate. And in general, not 100% of the time, but in general, that is not going to be someone who's going to be a good candidate for Inspire therapy. Now, that being said, there are some newer techniques that have been developed. I was just talking to some ear, nose, and throat doctors last week about this, where there are now ways to surgically kind of stiffen part of the airway so that a person can get their airway on the right looking more like the airway on the left. And so Inspire therapy can be effective in those cases. But right now, the majority of patients who have a complete concentric collapse on the right would be unlikely to go for Inspire right away. We really like to see it on the looking like it is on the left-hand side. About that being said, for patients who meet those ABCDs, about 85% of patients will have an airway that looks like the left-hand side. So most people qualify anyway. So let's say you qualify, then the ear, nose, and throat doctor discusses the risks and benefits with you, and then they will submit things to your insurance. And we'll talk a little bit more about insurance qualification a little later, but then they schedule your surgery. And so the surgery is an outpatient procedure. It usually takes a few hours, but you are sent home the same day. Very rarely do they ever need to hospitalize someone for observation overnight. The surgery has two small incisions. There's one incision that's under the chin, and that's where you can see exactly where the green circle under the chin here kind of is in that area. That's where one of the incisions is. And then the second is actually right over the implant itself. So it's just above the collarbone. Recovery is typically fast. The majority of patients just use over-the-counter pain medications for postoperative pain within the first few days. Patients are able to return to non-strenuous activities within a few days. We do ask that patients avoid any significant heavy lifting or significant strenuous activities on the side of the implant for the 1 month after surgery. That is to make sure that nothing gets pulled out of place. So no, weightlifting, no big heavy jugs of milk or bowling or anything on that side for the 1 month after surgery. We just want everything to heal in very nicely. The majority of the device is actually a battery, and that battery lasts at least 11 years. The changing of the battery is not a difficult surgery. It's not having to go through the whole surgery again. Basically, what they do is they make an incision over the device, so right where it is over the collarbone. They pop up the device, they put in a new battery, and they pop it back in and stitch you up. Because this is a pacemaker, basically, pacemakers have been around for decades. This is a technology that doctors are very accustomed to. And so there's no surprises with this. So this is something that, that battery replacement on pacemakers is a very commonplace procedure. We are very happy to announce that MRIs can be safely performed on the full body at this time. There used to be some constraints just from the FDA, but now, with certain protocols, full body MRIs can be done with Inspire therapy. Next slide, please. So about a month after you have the procedure, then you come back to our office at the sleep clinic, and that is a day of great celebration because we get to activate or turn on your device. And so that's when we turn on the device for the first time. We establish the initial settings that we're going to get you started on for your treatment. We determine what's comfortable and effective, and we make sure you know how to use your remote. So you can see here, basically you're just lay down on the exam table. We have a tablet that communicates with the device. We put in some settings. We see how your tongue is moving. And then we make sure you go over knowing how to use the remote. This is a little older video, so it shows a little take-home tablet that people used to get that had all the instructional videos. What's wonderful now is that all these videos are available to everyone at the Inspire Sleep website. So you can go to inspiresleep.com or on the Inspire Sleep app. So I strongly encourage anyone who is interested in Inspire therapy to either download the app or go to the website and watch those videos. You will learn so much about what it is like to use Inspire therapy. These days, all my patients have watched those videos. By the time they come in for their activation visit, they're ready and raring to go. So the activation visit is usually really quick. I'm going to say 20 minutes, 30 minutes, less than 30 minutes. And so we just put in the settings. And then what a patient does once they're at home is that there are 10 notches on the back of the device. They're little lights, and each week a person will build up, basically. So they start on notch number 1, and then use that every night, and that brings the tongue forward a certain level. They get acclimated to that. The next night they go to notch 2, and then we just build up until the point that the person feels that it's still comfortable and that it is feeling as effective as possible. And then we see our patients back after about 4 to 6 weeks, and we do a download from the device, and then we talk about the next steps. Next slide, please. So this is the 1 month after activation check-in visit. And so our goals are to confirm that it's comfortable, that a person's getting some benefit from it, and to make sure that they're using it well. About 3 months after activation, then we bring a person into the sleep lab. And our goal is to kind of fine tune things. This is actually called the fine tuning sleep study. And so we want to get the apnea index tailored to be as well controlled as possible to make sure that, we're getting the apnea well controlled. And this is kind of our technologist note tabs that we kind of fill in all the information. But basically, next slide, there are kind of 3 check boxes that we want to have checked off. One is the person using the device greater than 4 hours a night? That's considered a standard in sleep medicine. That's the minimum usage of any treatment that we would want to see. The second is the person feeling better. And then the third is their apnea index less than 15 an hour, meaning have we gotten rid of moderate to severe sleep apnea? Are we mild or normal? Okay, next slide. So within that month after this study, about 70% of patients have checked all the boxes. Okay, so their usage is great, their symptoms are improved, and their apnea index has improved significantly. Okay, great. For those folks, next slide. Then we just review that, make sure everything's programmed in, we confirm everything's looking good, and then we follow up every 6 months. We will probably do a home sleep study every 12 months or so. That varies, we don't kind of write that in stone. We follow that clinically and just make sure that a person's apnea is well controlled, and we'll talk a little bit about that. About 30% of patients have not checked all the boxes. That means that maybe, they're not quite using it enough. Maybe they're having some challenges with stimulation, or maybe the apnea index wasn't, it's improved significantly, but we haven't gotten it quite to goal. But, we're getting some improvement. And so then what we want to do is make some adjustments to the treatment. Next slide, please. So one of the things we know about Inspire is that we can follow it just like we do with CPAP. So we can follow the usage. And with Inspire therapy, there are adjustments we can make to the stimulation. We can adjust not just the notches, but there are adjustments in how the stimulation is delivered. We can adjust how quickly the stimulation is delivered to the nerve. We can adjust the strength in terms of how the flow of it. We can adjust which fibers are being stimulated. All of those things can affect the comfort and therefore can affect the power and how it is moving the tongue. Next slide, please. So let's talk a little bit about the effectiveness of Inspire therapy. And so as Rudy was hearkening to before, this is kind of my story of how I came to Inspire therapy. So When I went to the sleep medicine conference, so we have an annual sleep medicine conference in our field. It is imaginatively called SLEEP, and it is held the first week of June, somewhere in the United States. And so I went to SLEEP 2008, I believe it was at that time. And I attended a small session that was being presented by some ear, nose, and throat doctors from Stanford. And I attended Stanford for my residency, and so I was very interested. And it was called Hypoglossal Nerve Stimulation for the Treatment of Sleep Apnea. And I thought it was absolutely fascinating. They were getting incredible results. Um, the idea of it, though, was just so beautifully elegant to me. The idea of preventing the apnea before it was occurring, just getting the tongue and getting everything out of the way, and doing that while the person was asleep, and just preventing all the body's responses that come as a result of the apnea, just seemed beautiful to me. So they presented wonderful data, but they didn't have that many patients in the study. I think it was maybe 5 patients or 10 patients or something, and that's the way new therapies always are. They only just have a few patients. So it was very exciting and it was very interesting. And I said, that looks great. I will have to keep an eye on this, but it was clearly not a treatment that was ready for prime time. And, when we go to conferences, that's how we learn about new treatments. And sometimes you will see things that are there and then you never see them again. But I kept watching that. And so every year, every time I would go to sleep, I would go to sleep medicine conference. I would go and find the hypoglossal nerve conference presentations and see if anybody was presenting and what the latest data was. And then in 2014 and then in 2018, the big studies started coming out. And one of the biggest studies came out in the New England Journal of Medicine. And that's one of our biggest journals. And that particular study had over 100 patients in it. And not only did it have over 100 patients, it followed them long term. And what it showed was that patients with moderate to severe sleep apnea, when followed over time, and also with what's called a crossover design, where you took people on treatment and you took them off, and you took people off treatment and you put them on, and so you switched them over and then proved that the treatment worked. It showed that it was a very effective, tolerable treatment. And so that was the big study that said to me, this is a treatment that is here to stay, and this is a treatment that's going to be very helpful to patients. So this is some of that data. That is called the STAR trial. And so the data showed that the average apnea-hypopnea index in the studies was 29.3. On Inspire therapy, it was 6.2. So a very significant reduction of apnea index. Next slide, please. Bed partner reported snoring had a very significant reduction. And in my patients who do have any residual snoring, they report to me that it is not at all what it was before. One of my patients describes it as a little purr, which is entirely different than the very loud snoring that they had prior to treatment. I have one patient who tells me that if he has a couple of beers on the weekends with friends, that his wife just will lean over and take his remote and turn it up a couple of notches to treat his sleep apnea and his snoring a little more on those nights. Because it's an adjustable treatment, you can do that on a night-to-night basis. So it's definitely something that we see significant improvement on with patients. Next slide, please. Patients like it. This is one of the biggest things and one of the biggest pleasures in being able to offer Inspire therapy to our patients. 94% positive feedback, and that is very consistent with our numbers. Now, when I look at a number like that, the first thing I see is, what about that 6%? Okay, why were those 6% neither satisfied or unsatisfied or unsatisfied? And I can tell you, I can't speak to everybody on that study, but I can tell you our experience. When we first started doing Inspire, which is now about 5-6 years ago, we did have a couple of patients who came to us with Inspire therapy, and they had gotten Inspire therapy at hospitals in different parts of the country. They were not originally our patients, but they came to us to have us manage the Inspire therapy. And they were not happy with Inspire therapy because, in my opinion, they did not understand Inspire therapy. They had understood it to be a set it and forget it surgery. They thought, I'm just going to get Inspire therapy. I'm never going to have to see a doctor again. I'm never going to have any adjustments. And it's just going to be out of the box, perfect. And that's it. And because that was their expectation, it didn't live up to that. And so they were not satisfied. And so they did not, I believe that they would not have had that experience if they had had very good education about what Inspire was. Now that we have good patient education as a requirement at our clinic for anybody who does Inspire therapy, we do not have that experience. Patients go in with great understanding of what Inspire therapy is. They're ready, they understand every step, and everything, I think, flows very well. So my goal and our goal at our clinic is 100% patient satisfaction. And that is what we strive for. And so that is why we love to do education and support our patients on Inspire. In terms of patient usage, patient adherence is 5.7 hours on average. Again, many patients say to me, why not 8 hours? Actually, 5.7 hours from a sleep medicine treatment perspective is very high. As I mentioned earlier, the standard is 4 hours, and that is anything greater than 4 hours on average per night is considered adherence to a sleep medicine treatment, for example, with CPAP therapy. So 5.7 hours on average is fantastic, and we do see these numbers and higher with our patients on a regular basis. Next slide, please. So as I mentioned earlier, New England Journal of Medicine and the STAR trial, the initial STAR trial was the one that kind of really landed it on the map for many people who were not aware of Inspire therapy. Since that time, there have been hundreds of studies. The STAR trial 5-year follow-up, multiple other populations are now being studied for Inspire. For example, up at OHSU, they're using Inspire in pediatric patients. So lots of people are now going to be able to use Inspire therapy. Inspire also has an Adhere registry. These are patients that are not part of a clinical trial. These are patients who are part of regular clinics. And the Adhere registry, patients are followed for the same endpoints that the STAR trial patients were. So what was their starting AHI? What's their AHI now? What's their snoring? What's their energy level? What's their usage? What's their satisfaction? And what's really wonderful about the Adhere registry data is that the data is looking very consistent to what was seen at the STAR trial. So what we're seeing is almost exactly the same numbers. So that tells us exactly what we had hoped, which is that this isn't a flash in the pan. We're seeing those long-term benefits. Patients who are on Inspire stay on Inspire. They like Inspire. They continue to use it. when I first started doing Inspire, it was very difficult to get insurance coverage. Almost everybody had classified it as experimental. Since that time, almost everything has changed. Almost every insurance company has a policy that covers Inspire therapy as long as you meet the criteria. Medicare covers it. The VA and military are actually early adopters to Inspire therapy. So as long as we make sure that we have dotted all our I's and crossed all our T's, we tend to get approval. That being said, it is very important that we do that properly. It is much easier to get approval than it is to not do it quite right, get denial, and then get the denial overturned. So again, when trying to make sure that everything's done well, we want to make sure the documentation is clean. We've done everything that the insurance companies have said, and then we, get all the documentation over to the ear, nose, and throat doctors to get things approved. So, next slide, please. So for the full list of information, you can go to inspiresleep.com and look at the benefits and important safety information. Inspire Sleep also has the Patient Ambassador Program, which is a wonderful program where you can call and get the name of someone who has Inspire therapy, and they will be able to answer a lot of questions that I am not able to answer, such as what does it feel like, and what did it feel like to go to through the surgery, what does it feel like to have Inspire therapy, and all of those things. And so it's a wonderful program, and I definitely encourage you to take advantage of that. Next slide. And with that, I will, it is my privilege to introduce to you one of my patients, Mr. Levernois, who is a patient ambassador, who is going to tell us a bit about his experience with Inspire therapy.
Hi, thanks, Dr. Breaden. So, hey, if you have any questions for me, go ahead and put them in the chat. I'm just going to ramble on a little bit about my journey so you can understand what I went through and how I started on this whole path and ended up where I'm at right now. So my journey started about 7 years ago, back in 2016. My wife would rudely wake me up in the middle of the night by rubbing my chest and saying, "You're not breathing, you're not breathing." And I was tired and I was grumpy and I would say, "I'm fine, I want to go back to sleep." And so that kind of went on for a couple of years. And later on, maybe 2018, it was a nice summer day. I was out working in the yard. And it was, it wasn't hot. It was like 60, 65 degrees. It's one of those perfect days to get out there and get some yard work done. And I was doing some light work, and all of a sudden I was lightheaded. I was dizzy. I could feel my heart going wumpity, wumpity, wump. And I just wasn't sure what was really going on. So I kind of thought, well, maybe I'm having some cardiac issues. So I went to see my doctor. She did some tests. She referred me to a cardiologist. I went through a whole bunch of different things. I had a stress echo, and a CTA with cardiac and coronary with contrast, and a whole bunch of different tests. And one of the first things he said was, "I need to refer you to see a sleep doctor because you might have some, it might be sleep related." And while I was waiting to get the appointment with Dr. Breaden, we kind of got through a couple different things. And, he's kind of scratching his head. He says, "Well, under stress, your heart is abnormal, but under stress, your heart is normal." Anyway, long story short, it was one of these kind of weird things we scratched his head a little bit about. So I had a meeting with Dr. Breaden in 2019. And she kind of went through the different paths of, the Inspire, and she had this little mouse device sitting on her desk. I'm thinking, oh, that's kind of cool. But she said, well, it's still kind of, not a lot of insurance coverage companies. We need to start down the CPAP path first. And so we did that. And I was on CPAP for almost 2 years. And if those of you are on CPAP, you kind of know what it's like. You can look at your Top Gun movie or your Darth Vader movie and kind of come up with some clever way of rationalize how you sound in the middle of the night. But for me, it was kind of a difficult thing because my wife was unhappy with the noise of the machine. I'd have to crank the mask right down really hard, and I'd wake up with a little red ring around my face. So it wasn't leaking, not really strong leak, but a little tiny leak. I could hear that. And you're just holding it in a certain position for the hose. I mean, it was just, if you guys have had a CPAP, you know what I'm talking about. Not a lot of fun. And so I did find that using a CPAP was better than not having a CPAP. And so through this whole process, I kind of call the CPAP maybe a 70 or 80% solution. I had a little more energy, but before I got on the CPAP, I was a walking zombie. I'd go into work and I just felt like I was totally exhausted first thing in the morning. I was even, misplaced my card key one day going into the office, and I was getting a new one, and the security guard said, "Well, it's right there on your belt." I hadn't even remembered taking it off and putting it on my belt. I just felt that things weren't really working. So with the CPAP, I was a bit better, but I was still tired. Around 1 or 2 in the afternoon, I was getting grumpy. My wife was getting very, very tired of my me being grumpy because she said, "You're not the guy I married. I don't know what's wrong. You're angry all the time. You're snapping at me." And it was just because I was just freaking tired. So I went back and talked with Dr. Breaden again. I said, "Hey, this isn't really working. What's next?" And she talked about Inspire a little bit. And at that point in time, Inspire was not covered by insurance, but the Inspire company actually had some people to help me through that whole process. So my company changed insurance programs. So I kind of waited until the new policy was in place, or the new program was in place. Went through, applied for it, denied. So then went through and did it again, denied. And the third one was actually to a third-party person, and that was approved. So this was now kind of in the middle of the COVID timeframe, and with all the stuff going on, I wasn't. Do I really want to have a surgery right now? I don't know. Well, let's just get it. Well, it's been approved, so let's just kind of go forward. We've gone through all this work and effort to do it. Looking back now, I've been on Inspire for about 2.5 years, longer than the CPAP. And I can honestly say it was the best decision I ever made. It's much better than the CPAP. I'm able to, hit the button and turn it on when I go to bed and turn it off when I get up. And I feel energetic. I have my energy back again. I'm, not like I feel like I was 25 or anything, but it's been a game changer for me. And so, having said all that, I'm not paid to do this. I'm doing this because it's made a big impact on my life. And when I went through this process, there was not an ambassador program, and I didn't have anybody to talk to. And for me, it was kind of a leap of faith. Is this going to be worthwhile? I really don't know. Let's give it a shot. Worst case, I just don't turn the thing on. I've been using it every night ever since. I think there was like one night I missed it because I fell asleep watching TV. Anyway, but for the most part, it's been a phenomenal tool for me. It's gotten me back to where I am. My wife is very happy with me now as my personality has kind of returned to what it used to be. So in general, it's been a great opportunity. It's been a great tool for me to kind of get back to where I was. And I just want to be able to help folks like yourselves who are going through this journey on yourself, with yourselves, and trying to figure out if this is a potential treatment for what you're looking at or not. So if you have any questions, again, feel free to pop them in the chat. If they're non-medical related, I'll answer them. The first question, are there offices in Oregon? Yes, Dr. Breaden is in Oregon. So I'm in Oregon. So I can answer that one very, very, very safely. And with that, I'll just let the rest of them go to Dr. Breaden.
Thank you very much. Yes. Yes, we are in Oregon. We are in Portland. We also have an office in Astoria, but the surgeons that we work with are typically in the Portland area. There are also some surgeons in Salem and Bend. So there's a number of different places in Oregon and Washington where Inspire is done, but we manage patients from all over Oregon. The second question that is listed, I have a pacemaker and was wondering if there is a contraindication with Inspire. Actually, there isn't. I have a few different patients who have pacemakers, and basically they have the pacemaker on one side and the Inspire on the other. And so they just have to figure out where they're going to put them. So no, you can't have a pacemaker and Inspire at the same time. The next question is, how effective is Inspire for side sleepers? There's no positional constraint. Actually, Mr. Lavernois, I can actually refer to you. Do you feel that you have any constraint in position when you are sleeping?
Not at all. When I had the CPAP, I was I'm pretty much a back sleeper. I get on my back and I'd hit the button and I just there. One thing that's really helped me out well as well too is I've got a bed that's got an adjustable head, so I can kind of give myself a 20-degree angle, which helps as well too. But and I know I don't move a lot because the remote for the bed is usually right on my chest, and when I wake up in the morning, it's right there too. But unlike the CPAP where I had to hold the hose so that it didn't wiggle and pop off, I have no concerns. I can flip over on my side or sleep on my side anytime, and it doesn't no issues at all with the Inspire device.
Excellent, excellent. So let's see if there are any other questions. There's a joke, but no other questions there, I think. Is the device installed on the sternum bone? No, it is installed under the skin, just above the collarbone. So actually, yeah. Do you want to point out where? Yeah.
Mine's right here.
Yeah. So.
And sometimes they can position in different places depending on any activities you might do that might need to position a little bit differently.
Yes, exactly. So yeah, so when you talk to the ear, nose, and throat doctor, they'll ask you that. If you have low to moderate sleep apnea, are you not a candidate? If you have mild sleep apnea, so the way sleep apnea is classified is mild, moderate, or severe. If you have mild sleep apnea, you would not be considered a candidate for Inspire. It is not FDA approved for mild sleep apnea. If you have moderate sleep apnea, then you are considered a candidate for Inspire therapy.
One thing I like to offer too, and I forgot to mention this, is my first home sleep study, my AHI was 47.8. Super high in that severe category. After Inspire, with the different processes, I'm down to 9.9. And if I had a sleep study, I'm probably a bit lower than that. So I got to tell you, it's working, and my numbers are down where they're in a neighborhood where they should be. I've talked with other ambassadors, and some of these guys are 1, 2, 3. I mean, they've got it really dialed low. For me, I'm happy where it's at right now, and I'll continue to work with Dr. Breaden if we can tweak it just a little bit more to get it down. But for the most part, I'm a happy camper. So
we don't chase numbers. We don't chase numbers. No, if a person's doing well, obviously, yes. If we can get improvement and a person's tolerating it well, and we can do that, then we can do that. So, but yes, no, we want to optimize treatment whenever possible. But I can't say that we're doing that to be in competition with the other patient ambassadors. No, that would be bad. So
actually, I was surprised when some of the people shared those numbers, because I was very happy with my 9.9, and I'm sticking there. So
yes, no, of course, that's an excellent outcome. So can you have a Watchman and Inspire? That's a great question. I don't think I've had that come up. I believe you can. Rudy, do you know the answer to that?
Hi, Dr. Breaden. A Watchman, I'm not sure exactly what that is.
That's one of the cardiac arrhythmia devices.
Oh, as a matter of fact, actually, that just came up today, and I'd be happy to send you a paper on it. The answer is yes. Okay. Indeed, we do actually have a paper from 2015 on that, and there are challenges with that at all.
Okay, yeah, I just don't think I've had a patient where that came up, where that question came up. So that's a good question. Yeah. And then how long is the timeline from sleep threat study through all the tests for Inspire and adjustment? That is going to vary from person to person. So it depends on if you've already been on CPAP, how much you've tried it, if, all of those things. And then, but let's say a person has already, they have had their sleep study that qualifies them. They've had treatment failure of CPAP and or BiPAP. They do qualify. If I refer a person to a local ear, nose, and throat doctor, they might get seen within, I don't know, I would say a month or two and get their DICE, and then maybe get the surgery a month or two afterwards. Rudy, what would you say? 6 months by the time they get activated?
Yes, I would say it's probably running about 6 months. On the shorter end, maybe it's 5.
Yeah. Yeah, I'm just thinking every single step plus insurance authorization and all that. So yeah, I'm thinking realistically 6 months. I think that would probably be, probably close to it. So I think that would be the timeline. So, all right. So, to kind of reiterate what Mr. Lavernois was saying, I also am not paid to do these sessions. I do these because I want to make sure that people are educated about Inspire Therapy. It's really important to me. I have so many patients who see the 30-second ads, who saw the Super Bowl ad, who see all the or hear radio ads about Inspire Therapy, and they say, it's kind of we're 29 minutes into a 30-minute follow-up appointment, and they say, "Oh, hey, doc, can you tell me about Inspire?" And I say, "No, not in 1 minute. I can't tell you about Inspire. Inspire might be a great choice for you." And so I really want people to understand Inspire well. I want them to make educated decisions, and I am happy to support any patients who are eligible to look into Inspire. And so that is part of the reason I do these sessions. And so we are always happy to give more education. So if you are interested in looking into Inspire Therapy, you'd like to set up an appointment either to establish or a follow-up appointment if you're one of our patients, and you say, "Yes, I've seen the session and now I want to talk about Inspire Therapy," please give us a call. There is our phone number. Our website is www.pacificsleepprogram.com. If you have insurance questions, there is a number for insurance there. The VA has a separate number there. And let's see, from that, I think I will go from there. Yeah. All right. Well, thank you, everyone. And now we are going to finish up with an excellent piece that was presented on CBS this morning on Inspire Therapy. Just a wonderful piece and a wonderful case history. All right. Have a nice evening, everyone.
In our morning rounds, a treatment offering hope for millions of sleep apnea patients. The disorder causes people to stop breathing when they're asleep. An estimated 22 million Americans suffer from sleep apnea. It puts them at greater risk for diabetes, heart disease, stroke, and memory loss. Patients who are older, overweight, and male are generally most at risk. David Begnaud shows us the new option helping some patients. David, good morning.
Nora, good morning. For those who struggle with sleep apnea, treatments like the CPAP machine can be hard to sleep with. They don't always work, and a lot of people just can't get a full night's sleep with it. But now there's a new FDA-approved device called Inspire, and it's gaining popularity. For some people, it's a last resort. Their life literally depends on it. The Cleveland Clinic named this kind of treatment #2 on its list of top medical innovations for 2018. We met a woman who finally found relief after more than 2 decades of trying to get a good night's rest.
I wasn't breathing. I wasn't getting the correct amount of oxygen. My thought process had gone.
Good job!
Peggy Saravo's memory got so bad, her family thought she had dementia. The 59-year-old was so exhausted, she says she could barely do her job as a nurse.
So people were noticing it, but you were too.
I was too.
You knew something wasn't right.
I knew, not as quickly as they did, but I knew I was in trouble.
Peggy has severe obstructive sleep apnea, where her throat muscles relax, blocking her airway and disrupting her sleep. On average, she stops breathing 53 times an hour. That's nearly once every minute during a night's sleep.
Give me an example of a night.
Up 4 hours, maybe sleep 2. This is the area where I would sleep.
Oxygen machine,
correct.
CPAP.
Correct.
She tried other
Close it.
treatments.
Take the mask, bring it over my face like this.
She did not find relief from the CPAP machine, a common treatment that delivers constant pressurized air.
The CPAP wasn't getting the job done, so you needed oxygen on top of that.
Exactly. And then that didn't work. That's when they introduced me to Inspire and saved my life.
Inspire is a pacemaker-like device implanted in the chest. It senses when your breathing slows down and sends an electric pulse to the tongue to stimulate it forward, keeping the airway open.
This has been revolutionary. It's been a game changer.
Dr. Maurits Boone is Peggy's doctor at Thomas Jefferson Memorial Hospital in Philadelphia.
She'd given up. She had memory issues. She was miserable. This is not a benign disease. As I said, this is a killer, and it actually shortens people's lives.
I didn't realize I had it so bad.
A few months after having the Inspire device implanted,
You just need to relax and breathe normally.
Peggy went to a sleep lab to see how it was working.
Right, so listen for me on the intercom, okay? Okay, great. Good night.
They ran tests throughout the night, and early the next morning, Dr. Boone revealed the results.
So before we activated the device, we have all sorts of problems. This is basically your brain saying, I'm not breathing, I need to do something about it. And after we activate the device, it's perfect. Look at your oxygen. Nice, stable, flat line, staying around 96, 97%. So this is as good as it gets.
Okay.
And as far as I'm concerned, this is a cure. This is awesome.
A study in the New England Journal of Medicine found that more than 2/3 of patients experience less sleep apnea after getting the implant.
It was like sleeping with a herd of elephants.
For years, all Peggy and her husband David wanted was a good night's rest. And now they're finally getting it.
I'm going to show you.
Every night, Peggy turns on the implant right before going to sleep.
What's it like to sleep now?
Great. Turn myself on. I go to sleep. And I sleep. And then I get up and I turn myself off. And I have a normal day like you and everybody else.
Come here, Max. Come here, Doodles.
It doesn't work for everybody, but man, it worked for you.
It sure did. It saved my life.
The ball.
Let it go.
Now, Inspire is not for everyone. It's only for moderate to severe cases like Peggy, and like any surgery, there is a risk of infection. For Peggy, she says her memory is back to 100%, and she's sleeping great at night.
And is insurance covering?
So insurance, it's a case-by-case basis. Her doctor had to kind of nudge the insurance company along, but they do.
Well, she must really love her husband after saying on national TV, it sounds like a herd of elephants.
They're sleeping together
Yeah,
again.
that is really great news.
So does she
Good
have to
for your
wear the
marriage, too.
mask when she's got the implant?
No, not anymore. Not anymore.
Wow.
And when she turns it on, she feels nothing. She can just feel it pulsating her tongue forward.
It's like a life-saving device.
Oh, it is.
Yeah.
Absolutely.
That's great.
Thanks everybody very much for joining us this evening. And of course, thanks to Mr. Lavernois as well as Dr. Breaden. Good evening.